Hello, this is Dr. Ely from ReadyRNs. Hope you all are doing well today. We're going to look at clinical decisions and specifically sepsis using our clinical decisions tool. Right now it's generating a pathway for sepsis, what nurses would do if they needed to treat it. And now it's creating a quiz to kind of test our knowledge on it. It gives a brief introduction. Says sepsis is a life-threatening organ dysfunction caused by dysregulated host response to infection. It can lead to severe complications, including septic shock and multiple organ failure. Prompt and accurate nursing intervention is crucial to improving patient outcomes and reducing mortality rates associated with sepsis. This protocol applies to all acute care settings, including emergency departments, intensive care units, medical surgical units, and is relevant for adult patients presenting with symptoms of infection and sepsis. So initial assessment. Upon patient presentation, the nurse should perform the following assessments. Measure vital signs, heart rate, blood pressure, respiratory rate, temperature, and oxygen saturation. Assess for signs of infection, redness, warmth, swelling, pain. Conduct a full body scan for potential sources of infection. Monitor mental status for confusion or lethargy. And obtain an accurate patient history, including recent infections and chronic health conditions. All right, let's start the quiz. In our first section, it's prioritization and immediate actions. So let's check it out. What's the critical first steps? So it gives us two options here. So let's go through the first one, see if it's correct. Ensure patent airway and adequate breathing, administering supplemental oxygen if indicated. Establish IV access, ideally insert 2 large bore IV catheters. Begin a rapid fluid resuscitation with crystalloid solutions, normal saline or lactated ringers at a rate of 30 mils per kilogram within the first 3 hours. Obtain blood cultures before starting antibiotics, very important. Prioritize within the first hour. Administer broad spectrum IV antibiotics as soon as possible, keeping in mind that the most likely pathogen based on facilities and patient history. Monitor vital signs and urine output closely. Report any significant change immediately possible. Let's look at option number 2. Focus on assessing the patient's pain level and administering analgesics as necessary. Supplement oxygen. Wait until after. Okay, we're already seeing some problems as far as focusing on their pain first, only giving oxygen if needed, delay the blood culture. Yeah, we got all sorts of problems in this one. Okay, so let's go on to ongoing assessment. Ongoing monitoring should occur every 1 to 2 hours for vital signs, including temperature, heart rate, respiratory rate, and blood pressure, mental status, urine output, and signs of worsening infection or organ dysfunction. Check laboratory values such as lactate levels and complete blood count regularly and adjust interventions necessary. Routine assessments should be conducted at least every 4 to 6 hours. Okay, sepsis is a very concerning issue, so I might even check vital signs a little bit more often, but it definitely has the most accurate information here. Let's go with this one. Ongoing interventions may include further IV fluid administration as guided by hemodynamic status, initiating medications such as vasopressors if hypotension persists after fluid resuscitation, administering supportive treatments such as insulin if blood glucose levels exceed 180. Therapeutic procedures might involve surgical drainage of abscesses or invasive monitoring. Ongoing interventions typically consist of initiating broad-spectrum antibiotics immediately without considering patient history, while also avoiding any fluid IV administration unless there's significant edema present. It's important to monitor blood pressure closely for 24 hours without further intervention. Okay. This one's good. And as you see, it's not meant to trick us. It's supposed to give someone that's learning about sepsis enough information to make them think which one's accurate, but we don't want to trick people. We want people to feel confident in their answer. So far, I feel pretty confident in those answers. What about, we are currently on outcome evaluation. Assess the patient for improvement solely by measuring the heart rate and respiratory rate while neglecting the other vital signs. Okay, that kind of sends me a sign that might not be right. So let's get to this next one. Evaluate the patient's response to treatment by assessing clinical signs, improvement in vital signs and level of consciousness, laboratory results, declining lactate levels, improving white blood cell count, and urinary output. Determine if the patient achieves stability and is moving towards recovery. Yep, I like those. Signs of improvement or deterioration. Signs indicating improvement include stable vital signs within normal ranges, increased urine output, improved mental status, decreasing levels of lactate, and resolving signs of the initial site of infection. Deterioration signs may include increased heart rate, hypotension, altered mental status, decreased urine output, elevated lactate levels, and a new onset of organ dysfunction. That one sounds spot on. Let's just double check. Signs of improvement may present as fluctuating vital signs. Well, if you're having fluctuating vital signs, I don't think that's a sign of improvement. Normal urine output despite ongoing confusion. Yes, we are going to definitely say this one is the correct one. Let's see how we did. Perfect, green across the way. All right, so let's go to the next one. Safety and infection control, actually super important considering we're doing sepsis. Let's promote hands-off procedures by minimizing physical contact with the patient. Limit the use of gloves to only when drawing blood. Okay, that sounds a little iffy. Let's go to the next one. Implement strict hand hygiene practices. Use gloves when dealing with bodily fluids and ensure that all equipment and IV lines are sterile. Isolation precautions should be considered based on the suspected source of infection. Excellent. And this one is for patient safety. Ensure patient safety by monitoring for falls, providing appropriate side rails, maintaining effective communication regarding any changes in condition with the healthcare team, and providing a safe environment. Sounds reasonable. Prioritize patient safety by minimizing interactions with healthcare staff, eliminating all side rails to promote patient independence. I think this one. All right, let's submit. Good, green on both. We'll hit next. All right, interdisciplinary communication, which is critical for sepsis. Regularly update the healthcare team, including physicians, pharmacists, and other specialists involved in the patient's care. Discuss the treatment plan, patient's response to therapy, and any adjustment requirements in real time during the rounds or care huddles. Sounds beautiful. Communicate solely with the nursing staff regarding the patient's progress. Okay, I already see issues there. So let's go with that one. Only inform the patient and family about sepsis in vague terms, avoiding detailed discussions about treatment options or potential complications. Probably not it. Let's go to this one. Provide education to the patient and family regarding sepsis, its implications, and the importance of early treatment. Explain the treatment plan, medications, and what signs to recognize for worsening condition. Promote engagement with the care team for questions. I think that would be ours. Let's look at the last one for documentation. Document all assessments, interventions, including timing, patient responses, and ongoing monitoring results thoroughly. Record any changes in patient status and communication with other members of the healthcare team. That sounds pretty good. Look at this one. Only document major assessments and the interventions performed without noting patient responses or specific timings. So you can see how ReadyRNs is trying to reinforce, look, this is kind of an extreme example of what not to do, but some people don't know that yet. And so this is part of the learning process. So this one is obviously correct. Let's double check. But, let's just for learning, let's do that one. And it was incorrect. So what we can do is change it to the other one. Try again, and it is green. All right. And at the end, it often provides whatever diagnosis you're doing or procedure. It'll give additional notes. And in this case, it says evidence-based practices, local protocols, and resources. Refer to current guidelines from the Surviving Sepsis campaign for updated recommendations. Local hospital protocols should be followed for specific sepsis bundles, including time-sensitive elements such as fluid resuscitation and antibiotic administration. Familiarize yourself with available resources within the facility, including sepsis care pathways and available consultation services. Beautiful. So right here, we've gone through all the steps, great detail about what to do with sepsis, and this is important and is seen often in hospitals. Once you're ready, you can restart the quiz. And up here, if you want to remember that this one was about sepsis, you can go ahead and write sepsis, even add some tags so you can track it in a different way later that we can show you. But now it's sitting right here, so you're able to find it whenever you want and start the quiz over again and go through it. All right, Hope that was helpful, and I wish you happy practicing.